Hello, everyone. Thank you for being here with us today. My name is Lucas. I'm the Nori from DENEM-Brazil, and today is our fourth Café com Prosa, where we talk about the pandemic around the globe, especially in the countries that belongs to EMR. And we have three special countries today with us to speak a little bit for us. But Mateus, who is the lawyer from CLEV UFPB, will be the host today. So welcome, Mateus, and thank you.
Thank you, Lucas. Hello, everyone. Good morning, good afternoon, good evening. My name is Mateus, as Lucas said, and I'll be your host today. And today we are going to see a little bit of how the countries of EMR, Eastern Mediterranean region, which is a division made by IFMSA, and we are going to see how the countries of this region are dealing with the pandemic. And for that today, we have the presence of three special guests. We have three medical students from three different countries. And first of all, we have Abdul Majid from Oman. He's a Noor.
How are you guys all?
Oh, okay. Then we have Safa, she's also a Noor from Morocco.
Hi, everyone.
Nice. And finally, we have Yasmin from Iraq. She's also a Noor.
Hello.
Nice. And just an advice to you guys, the certificate link, it's already on the description of the video, but it is locked. And as soon as we open it, we will let you guys know. I will tell you, and in the chat, it will be told to me. So Abdul Majid, you can introduce yourself and start your presentation.
All right. All right. So my name is Abdul Majid Al-Blushi. I am the National Officer on Research Exchange in Mexico, Oman. Now, before I talk about how did we handle the pandemic, I would like to start by introducing you guys a bit to Oman, just on the aspect that you guys understand how such a pandemic will affect it. To start with, Oman's map, as you guys can see, we have the main body of Oman, and we also have small parts, just like on the top. We have Musandam, which is a part of Oman, but unfortunately, geographically, it is separated. So you can see it's this part on top. I don't know if you guys are seeing my laser. So, and then there's also the islands thrown around, and there is also a small part of Oman just in between here in the UAE. Now, the geography of Oman is very variant. We have the rocky mountain living areas. We have the people who are living in the coast, and the people are simply spread all around the country. The Omani people, what makes the Gulf countries and Oman in specific different from the global is the fact that most of the families are very big. For example, if I take an example of myself, I have about 21 uncle and auntie, each one of them with their children. And we usually have big family gatherings. And so, for example, every week I will gather with my entire family in my grandmother house, and it's normal circumstances. 99.9% of Omanis are Muslims, so we gather 5 times a day in mosque to do our prayers. As you guys can see, the curve for the population of the Omanis, majority of our population are in the younger side. We are known for having big celebrations, and even our traditional dances and activities are usually done in a large number. So as you guys can see, such a dance, a traditional type of dancing with sword, it has many people involved in it. Again, we all go to the mosque 5 times, which is a place where we all gather up 5 times a day. So let's start about Corona. We started recording our first cases in the beginning of March, but one important day was the 18th of March, 2020 for us, because that day we recorded the first 2 cases of unknown origin. All the other previous cases, all the other 31 previous cases were people coming back to the country from infected areas. But those 2 cases were the first that we did not find out. They were not coming from abroad. They were not in contact with people coming from abroad directly. So that is when the pandemic started in Oman. Now, a committee was founded after the order of the Sultan Haytham bin Tariq, the leader of Oman, the ruler of Oman. And this committee was responsible to taking all the decisions related to the management and control of this pandemic. This committee included many people, including representatives from the Oman military, Oman police, the medical field representative, and the Ministry of Health, as well as the Minister of Education and many others. They will gather up every so often what is required to make decisions related to the pandemic and its management. And their first was in 18th of March, when, as I said, we found out those few first cases, the 2 cases that were not coming from abroad. They were not in contact with anyone that was coming from abroad. So what was the type of regulation put in place to try and maintain the pandemic from spreading and to try to flatten the curve before it goes up? Well, to start up, all the entries to the Sultanate were closed, including ports, including airports, and the roads. Mosques, which we used to gather 5 times a day to pray all together, were closed, and everyone was ordered to pray alone at home. Traditional markets, such as the one you see in the picture, were all closed. All the restaurants and cafes, you no longer can eat and dine in them. All the sports clubs and gyms were closed. Gatherings are all postponed, and touristic sites closed. So all the beautiful beaches of Oman were left empty to try and control the pandemic. Mosque again, all of our malls that are usually very busy and full of life, they were silent. Now, how did the people react to such an event? That suddenly the government came, it said we have a pandemic spreading and so on, and we're going to shut down everything, about everything. To summarize it, after the proper introduction and informing to the public of the pandemic, the complications that it may carry with, the fact that people's lives are at risk, the sum of the population started to understand that, and they stayed home. Other than the fact that they used to go to work with 30% manpower in every institution. Other than that, majority have stuck at home. Unfortunately, some have broken the laws, and some did make wedding parties, did go gatherings, they gathered up in the beaches, and so on. So at that point, the police force and the military force used a different method to try and prevent that from happening, including fines, such as a wedding fine. Doing a wedding in the Corona period was fined to be about 5,000 euros. Now, work have to continue on. So what happened is many of the institutions that already had online platforms, they developed their platform through the period of the pandemic. For example, the police force, all the paperwork related to your cars, your payments, bills, you could all do them through their app now. You no longer have to go there. All the companies that are responsible, for example, for providing services, have made their new platforms that could communicate with people. So all type of paperwork and office work have been shifted to new platforms that allowed the continuation of the work, as well as preventing the gathering of people all together in places. Now, the police force and the hospitals were also using the lately developed technologies to try to control and assist in the reduction in the spread of corona. For example, police officers use drones with speakers to announce to people and warn people about staying away from beaches and so on. They use other drones with sterilization machine to sterilize public places, shops, and so on. The health sector also introduced the bandage, the follow-up bandage, which allows the ministry to follow everyone that is registered as a case of corona to make sure that they have not leaving their house, that they do not go into malls. So simply if one of them tries to enter to a mall, the mall alarm system will go on and you will be asked to leave, and he will also be he will also be given a fine. And in the meanwhile, we all know that businesses, especially small and intermediate-sized businesses, were affected. So the government also put in work on trying to reduce the losses of these institutions or businesses. So all taxes were withdrawn, all their loans were postponed, as well as some personal loans that have for people who have been affected. And then factories and manufacturers and companies, they were examined of paying their rent for 3 months. So again, restaurants, companies, and factories, the company all try to help each one as much as they can to make sure that they stay open, to make sure that they do not get damaged because of the pandemic. Now, there was another aspect of what happened. If you guys remember back in the map when I was explaining, I told you that we have like parts of the country separated from the mainland, such as Musandam, the one on top. So Musandam, what happened to it, because of the closure of the borders between Musandam and UAE and then Oman, so people from Musandam, their supply line of food, oil, and other important goods were stopped. So a solution for that had to be found, because these people, if all these supplies did not get to them, they might starve, the infection may spread between them. So what happened is that the government used the force of the Navy as well as the Air Force to transport oil, transport goods, all the requirements that the people living in Musandam needed. They also used military helicopters, which were equipped for carrying people, especially those who needed urgent transport to the hospitals back in the capital. The country also made pages in different social media accounts trying to fight rumors that are spreading around about the infection, as well as spread the informations about the current situation of corona, the cases recorded, and so on. So one example is Oman versus COVID-19, which is actually the account I like to follow in Instagram, but there is a Twitter platform, a Facebook platform, and so on. Now, fast forward, and by May 24th, the total number of cases got to 7,770. Unfortunately, we have 37 deaths at this point, and about 400 new cases per day. And if you guys look at the map, the red area specify the highest rate of infection and highest number of cases. Now, just so you guys do not misunderstand the information provided, the area in red is actually the capital, where the largest population between all different cities situates. So it is mostly associated with that, not the fact that the remaining of Oman had a higher degree of collaboration than that area. It's simply the fact that it has a higher population. Now, how did our health system handle this increased number in patients, and as well as the fact that it still needed to handle the patients it originally follows? So what they did is, one of our main hospitals back in the capital, the Royal Hospital, the entire building in it, which was previously allocated for the cardiovascular surgeries and cardiovascular wards, were switched to a corona controlling building. So there was separated beds just for the corona patient. The faculties that used to handle the corona patient were only handling corona patients to make sure that they do not spread. And then regarding the medical equipments and medications, all the factories here in Oman, which used to provide the medical faculties with their equipment, have increased their production rate. And thankfully, we never had shortage of medication, masks, and so on, even though the surrounding situation that did happen around the world. And then we also made ventilators. As a local company started making ventilators as a preparing step, that in case things went worse and the ICU rooms are not enough for the patient, there was ventilators that are made locally that have been qualified to be able to handle these type of patients, corona patients. So where are we today? As we stand today, we have a total sum of about 81,000 recovery out of about 86,000 cases. We lost about 689 patients, and the overall recovery rate is 94.3%. So out of this, are there any good news? Well, yes. Just lately, in the last month, we started to see signs of life going back to Oman as it used to, as malls opened a month ago, followed by restaurants 2 weeks ago, as well as gym 1 week ago. And we're waiting for the airport to also open and allow international trips, hopefully in October. So I hope life goes back to normal and we step this step of corona and continue our life. Thank you for your listening, and this was me. Yeah, any questions?
Okay, so thank you, Abdelmajid, for your excellent presentation. There's one question for you. What are the exchange perspectives you guys have for the next months? When are you starting receiving incomings again?
All right. So unfortunately, because of the situation that happened and the closure of the airports, we were not able to host any incomings in the past summer months, as well as the rejection from the hospitals, as well as the universities of accepting any external students at the time. But hopefully, with the opening of the airports in October, we will be set and ready to host new students by, let's say, July, as we start our contracts by that month.
Okay. Another question. Did Oman free tested everyone?
Okay, yes, Oman actually provided tests to everyone, Omanis and non-Omanis, anyone that was in the Omani lands and had any suspicious of having corona, of having any symptoms that could be related to a respiratory disease were tested for corona, and usually the results were used to show in 2 days, if not in the same day.
Okay, and I think that's it. Thank you, Abdelmajid, for your presentation. And now I will call Safa.
Yes.
Okay, so you can introduce yourself and talk a little bit.
Okay. So hi everyone. My name is Safa. I'm from IFMC Morocco. I'm from Morocco. I think that if sorry, Mateus, but everyone is from Brazil, or they're all from Brazil?
I believe so.
Or okay. So if you are from Brazil, I think that you know Morocco from a TV show that was quite famous, I think, a few years ago, but I don't remember the name. And it was held in Morocco. So Morocco is okay. So geographically, Morocco is under Spain, and So Morocco is under Spain and under France. It's in North Africa, and it's next to Algeria. So as you know, Spain, France, and Italy are countries that were really affected by the coronavirus. So it's also affected Morocco because quite of Moroccans were in Spain or were in France and Italy, and they came back to Morocco. The first case of coronavirus came from Italy, I think. So in the beginning, Morocco was doing really great in the beginning of the pandemic, and was taken as like an international example. In fact, the government had decided to take drastic decisions, and this from the beginning, to limit the expansion, and they put like a lot of efforts to save the economy of the country. They declared the state of health emergency on, I think, the 15th, I think, of March, and this only a few days after the first cases. They decided to close all the borders. They decided also a strict lockdown for the inhabitants, and the school closures and everything. Like everything was closed, and we couldn't go out except if we had a paper stamped by the police. And the police, they were everywhere. They controlled everyone, and we need this mandatory paper to go out, even if we wanted only to go to the pharmacy or something. We needed that paper. If we didn't have it, we were asked to pay fines. And one of the priorities of the government was to extend the capacity of the hospitals, because Morocco is not that big, and our hospitals are quite small, and they didn't have the capacity to accept everyone. So one of the first objective was to extend this capacity and to take drastic measures so that not everyone should go to the hospital. We could only treat them in home, and to avoid those high risk cases. Some hotels provided rooms to the doctors and also to the patients in recovery. So patients went to the hospital first, and then they went to the hotels for 2 weeks, and then they go back to their houses. And also a lot of organizations helped by giving food every day to the health workers, and free transports as well, like the school transports were provided to the hospitals for the doctors and the nurses and everyone. And the 19th of March, the government declared that they will give a monthly payment to some families that needed help. It was, I think, 70 euros or 100 euros per person. And this until the end of June, like 100 each month until June. And almost all the factories were turned to mask factories and respirators factories. So they produced like in total, like in Morocco, they produced 5 billion masks per day. And even the selling price was subsidized by the state so that everyone could afford it. I think that 10 masks were at €1, and it was like nothing. For this, they deployed a special COVID fund for the management of the pandemic, and it was 10 billion Moroccan dirham. And 10 billion Moroccan dirham is almost 1 billion euros. So 1 billion euros was provided by the government to fund all of this, like the factories, the health, the hospitals, and everything, and also the fund that was provided to the poor families. And also private organizations give a lot of money, and also the very rich Moroccan gave money for the government to handle everything. In that time, like until the 7th of April, everything was fine. We didn't have a lot of cases, and everything was manageable. Even our death number was quite low. Yes. So the 7th of April, in addition to this paper mandated to circulate, the government declared that the wearing of masks was mandatory. And until then, as I said, everyone respected the lockdown and was taking the pandemic seriously, because it was only 1 month. Like during 1 month, everything was manageable. Everyone respected the lockdown, and we were in our houses. We didn't go, even or something. Just one person per house could go out, because one person could have that paper to go out, and they needed to buy like everything. They did. I think that they went out only one time per day to go out, because even the paper was stamped by the pharmacy or something with the date of the day, and they couldn't go out another time. And on national TV, there were a lot of advertisements to sensibilize the population, a lot of videos on how to wear the mask, on how to wash the hand, how everything. The 18th of April, the state of health emergency was declared extended to the 20th of May. So if we follow from the beginning, it was declared the 19th of March, and now it's extended to the 20th of May. So March, April, and May, it's like 3 months. And this until further notice. But on the 18th May, they decided again to extend it for 3 more weeks until the 10th of June. So from the 19th of I think March to the 10th of June. Okay, and with this last minute extension, it was declared like 2 days before the day of the end of that lockdown. So with the last minute extension, the population was beginning to be angry, and specifically the ones that lost their job during the pandemic. Everyone wanted to go back to their normal life, and they didn't want to be stuck at home anymore, because it 4 months was really a lot. So the general thought was extremely critical in that period, specifically because it was the end of the Ramadan. What is Ramadan? Well, Ramadan is a holy month where we fast every day. And normally we spend the first day after that month with our families and everything. So the government, I think that the government made it in purpose to declare it like at the end, so that no one can go out, no one can go to their family to avoid the gathering. So really the tension was everywhere, and we were all angry. So the 28th of May, some cafes and restaurants were open again, but only the ones that could deliver or that could handle the takeaway orders. But there were some sanitary measures that they needed to respect. So at that moment, so the end of May, the population wasn't really respecting the lockdown compared to the beginning, because the beginning was really strict. But then the people got tired, and they did go out, even if they didn't have the paper, even because now, like, it was even, I think, the policemen, they were pissed off, like asking the papers every time. So things were easier, I think, and people like we did go out. And the evolution of the pandemic was it was getting tired and tired, because everyone was tired, and it was hard to tell everyone to stay at home like for months. Like it was like 4 months. It's too much, and that. So the government decided to plan the confinement progressively. Well, what I mean by progressively, because it was dependent on the epidemiological situation of each region. There were 3 phases, and they separate the region into 2 zones. So the zone 1 was the regions with like quite with the low amount of cases, and the zone 2 was the population with a lot of corona cases. So the first phase began on the 11th of June, and as I said, the regions were spread into 2 zones. So so they decided to continue the lockdown in the second zone, and the first zone could circulate normally. But it wasn't. It was forbidden to circulate from the first zone to the second zone, unless if people got an authorization from the police and an order of mission from their work. The second phase of that the confinement began on the 25th, I think, of June, and only four cities were still in the second zone. There, every region was in the first zone. So starting from the 25th of June, things were quite, I think, lighter, because everyone could go out, but the wearing of masks was still mandatory, and there were a little bit of restrictions. It was still forbidden to circulate between the first zone and the second zones, and the cinemas were still closed, because it's something that it's like closed, and it's risky to keep it open. And even hammams also, or big gathering, for example, as weddings or funerals and everything. Like only the coffee that were open, and some restaurants and everything, but the places that were closed were closed. The third phase began on the 20th of July, and then everyone would circulate freely, and it had as the principal goal of the government to let everyone go out, was to promote the national tourism, because Morocco is a country that lives from tourism, and keeping tourism, and specifically in the summer months, and the borders were still closed, so we didn't have strangers that come from our tourism. We were only Moroccans stuck in their houses. So the government decided to open the national, not the national, but the regional borders, and we were able to go to other cities, to go to the hotels, to go to the beach, to go everyone. and the purpose was to revive the economy of our country. I remember that in that period, everyone was traveling. It was like a breath of fresh air that everyone needed, and it was really, really strongly needed. But sadly, it only lasts like 1 week, I think, because this ray of light only lasted, as I said, 1 week, and from nowhere, without it was really nowhere. It was like this. It began, I think, on Monday, and then on Sunday, suddenly the government, they declared, like I think it was at 1 p.m. They declared that it will not be allowed to go in or to go out from 7 cities, and my city was among those 7 cities. And this was effective from midnight. They declared it at 1 p.m. and at midnight we couldn't circulate from or out some cities. And the press called this day the Black Sunday, because it created a lot of panic and even accidents, because everyone was traveling and everyone needed to go back to their cities. So the highways were never seen like that before. I remember that day my mother and my sister were traveling in different parts of the country. One was at the north, one at the south, and they were obliged to go back that night. It was really a real nightmare. And after this incident, the whole month of August was, I think, subnormal, because we were going back to the life normally, but with our masks. Like we were asking to live with the virus. So we could travel nationally, and we went to the beach, to the restaurants, like a normal summer. But we were asked to respect the health measures, as wearing our mask, washing our hands, and the temperature was taken before entering to any place. So the situation was manageable in the beginning of the pandemic, because, as I said, we didn't have that much cases. We had the maximum was 80 cases per day, and it was when we had 80, it was a lot. But and this was when we were in lockdown, but we couldn't stay more at our house because of the economy of the country. But now, when we are not in a lockdown anymore, the amount of cases has highly increased, and normally the start of the school year was scheduled for Monday, for past Monday, like the 7th, and the parents had the choice to either have virtual classes or send their child, but respecting some restrictions. But on Sunday, again, without, it was from nowhere, suddenly the government again declared that the e-learning was mandatory cities, like the schools and the universities should close. And we have now a curfew at 10 p.m. and also the cafes, they will close at 10 p.m. and the restaurants at 9 p.m. It was from nowhere again. Like we were having a normal life in August, subnormal life, because we were asked to have our masks, and the restaurants closed at midnight. But now they close at 9 p.m. and we have a curfew at 10 p.m. starting from last Sunday. So I think that now the situation in Morocco is critical, because now we have 1,000 cases per day, and before we had, like I said, 80 cases. It was the maximum amount. But also there's something to know, that in the beginning the government couldn't afford a lot of tests per day, so they tested only the persons with the really symptomatic persons and the suspicious one. But now, like the tests are available in private laboratories, so people can pay for themselves to have the test. So we test more and more, and that's why I think that we have more cases than the beginning. But we still respect the minimum measures, and I think that it won't be a surprise if another lockdown is declared in the next few weeks, because they are already preparing us by this curfew at 10 p.m. and gave us like a little time to, and they did give us a little time to travel and to breathe. And now, actually, we have 75,121 declared cases. It's like a lot. It's not a lot compared to Brazil, but it's a lot in Morocco. 75,000 cases, and but even if we have a lot of cases, our amount of death is still minimal. Because it's 1,400, so 1,000 compared to 75,000 is not that. It's a lot, but it's not that much. And we have 57,000 recovered. So I think that's all. If you guys have questions.
Okay, Safa, a lot of major twists, a lot of complications, and but you did well. A lot of complications in Morocco, of course, but you
Really?
did well.
Okay.
No, you did well.
Yeah.
You did great.
We were doing well in the beginning, but now like the situation is really hard to handle. But we don't have like a lot of deaths, as I say, and we don't need respiratory machines that much. But it's hard.
I get it. So there's a question for you. Did you guys have so many news about false treatments like hydroxychloroquine and stuff?
Okay, so in Morocco, we didn't have that debate because Morocco, from the beginning, used chloroquine. Because I think that we have this drug. It is I think that we have industries in factories in Morocco that produce chloroquine. So they produce it like before. So they used it because they produced it before. Because we have that national industries, we could like have our stock. So we didn't need the help of other countries. So they used it like from the beginning, and the debate was never. I think that it was never. No, it was never like we used vitamins. We used paracetamol and chloroquine from the beginning.
Okay.
How? Okay.
I can read it.
Yeah.
So another question: how are you dealing with distance learning?
Okay. So so I will talk about myself. In my university, we had distance learning from March, like from the beginning of the lockdown. And it was quite good, I think, because we finished our school year, like we had all our classes, and my university already had the platform. They just didn't use it, and it was I think the opportunity to use it, and maybe to see like things a different way. Maybe they will use it now more and more, or they will use it like 50% the time, and 50% the time it will be presential. But in the schools, it was, I think, harder, because the child, like, they don't really focus on internet, because there are a lot of distraction and everything, and the parents should every time be here, like, did you do your homework, didn't you, or what are you doing, don't go to Netflix, don't go to this and this. But it was good, and now it will be distance learning again, because the universities will remain closed, and schools will remain closed. And as I said, in Morocco, it was summertime, like from July to August, from mid of June to July and August, it's summer months, so there is no class. Not like Brazil, it's the inverse.
Yeah.
Yeah.
So okay, the thing about the child, it's so true. I have a child sister. She, when she's in her classes, she's always distracted and saying YouTube, Netflix, and stuff. So it's really a situation.
Yeah, but our exams were presential because we had our exams in July. It was postponed to July. Normally we have our exams in the beginning of June, and now with the pandemic, the government decided that medical universities will have their exams in July or August, and the other universities, because they don't have clear chips, will have their exams in September.
All right. Yeah. So that's it. Thank you, Safa.
You're welcome. It was a pleasure. Awesome. It was. I hope that you followed me because it was quite a lot of information.
Okay. Thank you very much. So I will call now Yasmin from Iraq. She will tell a little bit about the situation in Iraq and how the government dealt and still dealing with the pandemic. So, Yasmin, are you listening?
Can you hear me?
Yeah, I can. You can start now.
Can you hear me?
Do you want me to share the presentation, right?
Yes, please.
Okay. Let me see. I'm sharing.
So, for you, I hope that you're your best. My name is Yasmin. I'm the National Officer of Research Exchange in Iraq. I am a fourth-year medical student. First of all, we will talk about a small introduction about Iraq. So, next, please. Okay, Iraq is composed of 9 governorates or provinces. The governments are subdivided into districts or qadas in Arabic, which are further into sub-districts, and we have regions which consist of
Yasmin?
and etc. is the only region in Iraq.
Your audio is
governorates will have major ones, which are
Yasmin?
which is the capital. We have Al-Anbar, and we also
Yasmin,
have.
Can you hear me?
Yes, can you?
We can hear you well. Can you try to fix it?
Yes, just a second.
Okay. Yasmin, we do not hear you.
Hi again. Can you hear me now?
Now we can. Awesome.
Okay, so as we said, Iraq is composed of 19 governorates, which are also subdivided into districts. In Arabic, they are called qada's, which are further also divided into sub-districts, which are in Arabic also called nawahi. And Kurdistan region, which is located in the north of Iraq, is the only legally defined region within Iraq, which contains almost 3 to 4 governorates. So let's go for next, please. Okay, these are the 19 governorates of Iraq. There is another one, which is Halabja, which is not included right now, but the capital of Iraq is Baghdad, which is located in the middle with the number 8. So can we go for next, please? Now we are going to talk about the healthcare system in Iraq in general. Spending on healthcare accounted for 6.84% of the country's general practitioners. In 2018, there were almost 7 physicians and 13.9 nurses per 10,000 inhabitants. The life expectancy at birth was almost 68 years in 2010, or 65 years for males and 72 years for females. Iraq in general has developed a centralized, free healthcare system in the 1970s using a hospital-based, capital-intensive model of curative care. The country depended on large-scale imports of medicines, medical equipment, and even nurses, paid for oil export incomes. Unlike other countries which focused on the mass health care using primary care practitioners, Iraq has developed a westernized system of sophisticated hospitals with advanced medical procedures provided by specialist physicians. The UNICEF and the WHO reported that prior to 1990, 97% of the urban and 71% of the rural population has access to free primary health care centers. Just 2% of the hospital beds were privately managed. So, we have general hospitals, we have PHCs also, and now we will be focusing on the COVID-19 in Iraq. Next, please. Okay, another next. The first reported case of COVID-19 in Iraq was, and the confirmed one, was reported in Najaf on the 22nd of February. This case has caused a lot of panic for the people, but also some people didn't believe in the COVID-19 existence from the first place, so by April, the number of confirmed cases has been exceeded the number mark, the 100 mark, in Basra, Baghdad, Sulaymaniyah, Erbil, and Najaf. Next, please. By this marked increase, the IFMSA the Iraq has set some strategic response plan against the COVID-19 in line with the global humanitarian response plan to the COVID-19, focusing on the following areas of intervention, which are the country-level coordination, the risk communication and community engagement, surveillance, the points of entry, national laboratory system, case management and continuity of essential services, infection prevention and control, also on the mental health and psychosocial support in COVID-19 outbreak, as a lot of people has started to panic and has started to develop some signs and symptoms of COVID-19 just because of their psychological status. and also operation support and logistics. And now let's divide them into more understandable divisions. Next, please. We will have the government response and impacts regarding the curfews, regarding the education, regarding the travel restrictions, the social issues and impacts. So let's talk firstly about the curfews. The government has stated a total curfew with a total lockdown of everything in the end of March, and the curfew has almost July. It then has been transferred from being a total lockdown into a partial lockdown, which has started from a lockdown startly from 6 p.m. to 6 a.m. and then it has developed from 10 p.m. into 5 a.m. only, to let all the employees get back to work and to start having life all over again. So next, please. Another next. Regarding the education, the medical universities were the first universities to stop going to school because they were the most infected places, as they were near the hospitals, and the students had a total contamination with the with the patients there. So in the 22nd of the February, the education had stopped in the med schools, and then during the 1st of March, the education have stopped in the whole schools, the primary, secondary, and even all the universities. And they have stated it as a holiday at first for a few weeks. And then, of course, the people and the students were happy about it because they had holiday out of nowhere. But then they kept exceeding it without a clear declarance about how the education is going to continue. And the students have also lost almost 3 months because of the revolution and the protests that have been going before, during the months of October, November, and December. So it was quite a mess at the start, and there wasn't any clear declaration about it. But then the government has stated to complete the year and finish it up with an online teaching system. We have relied on the Google Classrooms for teaching purposes and for the exams, as we are having our final exams right now online also, with some strict systems of opening your camera, opening a microphone, and having just short time for having your exam. For the clinical part, or for the practical part of the universities, for some universities as mine, it has been suspended to the next year because they thought they wouldn't have the best quality online. But for other universities, it has continued by having video calls and meetings with the students, teaching them, and also by having their exams by video calls and asking them about some kind of cases, and having their practical exam on Google Sheets, and by having photos and multiple choices for the questions. Well, at the start, for the education, the students were happy about it because, as I said, for the holiday. But then it became a little bit of a mess. So the students have panicked about it, but then the government has stated like they will get an easier questions, and they will deal with the internet issues, and they have provided free cellular data for all of the students in Iraq, which were very fast and good to perform their final exams. And till now, we are still having our final exams, which I will be having next week. So wish me luck, please. So this is all about the education. Now we will be talking about the travel restrictions. So next, please. Next. Okay, regarding the travel restrictions, the Iraq borders haven't been closed really early. They have been closed in the late February with Iran, which was allowing only Iraqi citizens that were returning. And after the widespread of the pandemic in Iran between the 8th and the 16th of March, the borders have been closed completely, and the trading with all of the countries have been suspended a little bit. In response to the outbreak in Iraq, by the 10th of March, Jordan has decided to restrict the land and air travel with the country, and also Turkey, regarding travelers from pandemic areas such as China, France, Iran, Italy, Japan, Singapore, Spain, South Korea, and Thailand were also banned from traveling to and from Iraq. On the 15th of March, to be specific, the government has announced that all the flights to and from Baghdad Airport, which is the major airport of Iraq, between the 7th and the 24th of March would be suspended, and then they have cancelled all of the flights from March until the 24th or the 25th of July, having no entry or no traveling at all, only for the people who want to return home from other countries. They have kept like one flight a week only for them. But after the 25th of July, the travel restrictions have been reduced, and then the airport has been opened completely, and for now we have almost full scheduled flights with the world, except with the ones that still have closed borders, and for the countries that have already visa issues, and now it's really hard. So I think that we don't have many flights with them for now. But for now, if you want to travel and you're an Iraqi person, you can travel as you want. You should only get your visa and then book your ticket and go. Regarding for the social issues and impacts, as Majid said when he was talking about Oman, we have big family gatherings. We have some religious gatherings also, which are during Muharram, which is this month, and others. And we had some big religious gatherings through May that have been also banned, and that have been closed for regarding mosques, churches, and everything. And regarding the restaurants, they have banned from working for several months, but then they have returned into working only by the delivery and the takeaway service. But for now, I think on the 12th of September, everything will be back opened and we will gain our life back as it used to be, with some precautions, of course. This was regarding the response of the government for the curfews, for the education, for the travel restrictions, for the social issues and impacts, and also with all of these things that have done and all of these strict stuff of the response. There has been a wild social media campaigns for teaching people about COVID-19 and about the ways of transmission, about how to stay safe from it, and about washing hands, wearing masks, and the stuff. Also, the government has banned everyone from going out without wearing masks. Some places have banned going in without any gloves and masks also, and they have put areas of antiseptics solutions all over the places. Like, you can walk few meters and then you will see the antiseptic solutions with a white sign of sterilize your hands, please, and also some signs in the ground for maintaining the social distancing from people. And this was all regarding the government response. Now we will be talking about the IFMSA Iraq response. So can we go to next, please? Okay. Regarding the IFMSA Iraq response, it was majorly by SCOF, which is the Standing Committee on Public Health. We have 1,071 primary healthcare centers in Iraq. Over 80% of them lack the basic water, sanitation, and hygiene, also infection prevention and control supplies. So SCOF, with the collaboration of other partners like the United Nations, they have tried to reach some goals, which are increasing the knowledge and the skills of the medical students to advocate about coronavirus preventive measures. They had increased the general public awareness about the virus and reduce the spread of the virus, and to increase the WASH adherence among the general public measures in the PHCs. And we could also get some our goals and outcomes, that we have more than 200 of IFMSA Iraq members participated in a very informative and interactive sessions about COVID-19. We have more than 250 of the general public attended online courses through webinars about COVID-19. We have 45 risk communication and community engagement messages were disseminated on the social media, and they have reached over 3.5 million people. We have also held more than 80 awareness field events in the PHCs about COVID-19 and their signs and symptoms and everything. We have provided the primary healthcare centers with 4,000 booklets about COVID-19 and PPE. We have also supplied the PHCs with soap, sanitizers, and disinfectants, and a lot more of the outcomes that we wanted to reach. Regarding the exchanges on the IFMSA, regarding the exchange during IFMSA, firstly, we have decided to cancel July and then August and then September, but as we were in the middle of August, with the situation only getting worse and the cases are getting more, we have decided to cancel the whole exchange season, which means no outgoings and no incomings for Iraq from now till the next April. and we will see if there will be an improvement in the situation or not regarding hosting incomings and sending our outgoings, because the safety of our members is one of our top priorities, of course. I guess that will be all regarding the IFMSA response, and now we will be talking about the coronavirus dynamics infographic. This infographic is a little bit cut, but it can show the map of Iraq with from the least infected regions or governorates to the most infected regions or governorates, which are the dark colored one in the center, which is mostly Baghdad, because Baghdad, although it looks small, but it's the capital, and it contains over 5 million people living in it only. And it has more than 466 cases. For now, we have 34,000 cases that have been cured. We have the active one, which were 6,000, and we have the deaths, which is a really small number according to the WHO. Can we go for next, please? Okay, this also will show us the more infected areas, and then to the least infected areas, which is the most infected one is Baghdad, and the least infected one is called Al-Anbar. Though that the Anbar is a really big governorate, but it hasn't been infected that much because it has been locked down completely and isolated from the other governorates. So it still has some small numbers, and until like 1 month ago, Anbar didn't have any case of coronavirus at all, but they have been started to develop number of cases, and now they have over 3,000 cases. Next, please. Okay, for today, we are having more than 4,800 cases per day. We have the daily cured cases are more than 3,000. We have the daily deaths accounts for more than 68, and then we are now almost in 198 days from the start of the curfew and the first confirmed case, and these numbers are only the confirmed and the stated cases. We do almost 10,000 tests per day. So we still have, I think, as a personal opinion, a lot of cases that haven't been declared, as some people are afraid from going to the hospitals. Some people are afraid of doing the tests as they think that hospitals are more contaminated and things. Can we go for now? For the next slide. Okay, so this slide has supposed to have a photo of open now. Okay. For now, the Iraqi government have opened more than 33 isolation centers, have turned a lot of major hospitals into isolation centers also for the COVID-19 patients. We have more than 5,000 cases per day. We are reopening everything regarding the malls, the employments, the like everything will be back to life. next Saturday, and people have shown their upset about the complete lockdown. People have showed their upset about the complete lockdown for many months, as some of them don't have some fixed salaries, so they need to have their work day by day in order to live. And despite all of the help that has been given by the IFMSA, by the UN and UNICEF and other major organizations, some people were still need to work to get their food and goods to continue living. So the government has stated that we will need to get back to life with, of course, having precautions. As for now, when everything is opened, you will have to maintain your mask on, you will have to have gloves on, and there will be some alcohol sprays and sanitization stuff all over the places. Like, for example, for restaurants, they should maintain 3 meters from each table to table, and they will have sanitization all over it, and you will not enter any mall or any restaurant or any public place without your mask. Like, they will try to tell you in a nice way, but if you didn't wear them, they will have to kick you out, because like you will be a source of spread. And I guess that's all for Iraq. I think, like, a personal opinion, that with the really bad state which the country is in, we have opened more than 33 isolation centers. We have developed a lot of strategies, and we have put the safety of the people first. I think that our government has did really great regarding the COVID-19 situation. But for now, still some people don't believe in the COVID-19. Some think that onions and garlic will cure them and like keep them safe from COVID-19, and they don't need their masks and stuff. So we're still not controlling the number of the cases till now. But everyone is trying for regarding the health centers, the government, even the military. So yes, I think that's all regarding Iraq. And this is a very recent photo of us. Almost the IFMSA Iraq TO had a small meeting physically. We have tried to see if like the environment is safe to hold our NGA in a physical way or not, which will be held in 2 or 3 months. But for now, we think that everything is not really safe for having such large and physical gatherings, and it will be really expensive. So we're still looking for that. And for now, I am done. And I'm really sorry that I couldn't open my camera right now, because I am a little bit sick, but you can see me as the last girl on the left. That was me. So I am done, and if you have any question, please feel free to ask me.
Okay, thank you, Yasmin. It was a very good presentation. We have a couple questions for you. The first one, if you
Okay.
was there some
So we have, was there some outbreak on the Iraq-Iran border? Yes, of course, at the start. There was a lot of outbreaks because of the religious gatherings that Iranian people wanted to come to Iraq, but then they have, like, after the outbreak of the coronavirus and the stuff, they have banned everything from the borders, and like they have controlled everything. So we can say yes.
Okay, there's another question. This one is larger. How is the government facing the challenge of protecting the IPDs, internally displaced persons that live in formal camp locations, and also the others that live in informal settlements from COVID?
Okay. So the government is facing really difficulties regarding the people who are internally displaced and are living in formal camp locations. But they have tried to build them some homes that, I don't know what's the word in English actually, but they are fast built buildings. They have tried to place them there, or they have tried to place some of the infected people of the COVID-19 in the isolation centers. And like also there have been a lot of donations that have been given for the government and from different places to build them houses and to give them like the suitable stuff for way of living, like to provide them with sanitation, to provide them with masks, to provide them with the gloves and all. But as you know, we have a big number of poor people. So I think we have tried to control as much as possible, and still we have some people that we could not control, as some of these people also who are of the people who don't believe in the pandemic and in the COVID-19 thing, despite all of the campaigns and all of the sessions about it and everything. So yeah, I hope I answered it in a clear way.
Yeah, you did. Last one. Yasmin, thank you for your presentation. Here in Brazil, unfortunately, we usually see people denying the pandemic, gathering around, having parties. Are you guys having those problems in Iraq?
Mm-hmm. Well, why do you think we still have more than 5,000 confirmed cases a day? It's because of those people mostly. We have a lot of people who are denying the pandemic and who are just thinking like gathering around, having parties and stuff. But like for the halls for partying and for the restaurants and everything that you can have a big gathering in, they have been closed down and banned from working for several months. So we could reduce the amount of people who had the parties and the gatherings, but also we still have the people who do the gatherings and parties at their houses in a very private way. Actually, we had some people calling to the police to tell about them. We have some people who did some funerals, and also the government has been called and have been worked about that. But yes, we have a lot of these people, and they are actually causing a rapid increase in the number of the cases. And the government is trying to be a little bit strict, like the military, if they saw them, or like the police, if they saw them, they will shut down everything and tell them to just go home and not do that again. And with the complete close down of everything, they had really small chances of having the gatherings and the parties. And also with the major campaigns on the televisions, on the streets and everywhere, can you imagine that we had also some military cars that had speakers on saying stay at home, don't go out and wear your mask, wear your gloves, and like just wash your hands and keep away.
So I think we had a problem with Yasmin internet. So she disconnected. But guys, also an advice, the certificate link, it's already on the description. Now it is open and you guys can fill it out. So I think Iago is going to do some presentation about the situation in Brazil, situation of the pandemic in Brazil. So Iago is a regional coordinator. Iago?
Hi.
Yasmin came back.
I'm really sorry, but I don't know what's the problem with my internet connection today. I have been trying to use the cellular data and then the Wi-Fi also, but still I'm having some disconnections, so I'm really sorry. Have you heard my answer regarding this question?
I think so. I think it was pretty much completed.
Okay,
So-
I think the last thing that I was thinking about it that we had some military cars with the speakers on saying keep away from people, stop gatherings, wear your masks, wear your gloves, and etc. And they are reminding us of queue and reminding the general shops and the places to close down when the curfew is about to start as a sort of campaign. So I think we're trying to do our best for now. And I think that's all. Thank you so much. I'm really sorry if I have to speak a lot. I had a lot of details to declare, so thank you so much.
Okay, Yasmin, thank you very much for your presentation. You presented very well. So now Iago are going to speak a little bit of the Brazilian situation. Iago, feel free to start.
Hello, good afternoon, good morning, good night, good evening. I don't know where you are. So my name is Iago. I'm a regional coordinator here in DENEM, at the regional Northeast 2, like Northeast of Brazil. And I'll talk with you guys about a statement we made 1 month ago, exactly 1 month ago, at August 90, about the situation in Brazil with COVID. So, Brazil reached the mark of 100,000 deaths caused by the pandemic of COVID-19 in our country, which has more than 200 million inhabitants, so many different countries, cultures, regions, and people. The impact of the COVID in Brazil was due not only to the potential threat of the virus, but also the lack of effective responses by the crisis of no government. We've been talking about the power of false words in our news time, but it may not be easy to gauge how much these factors actually affect people's health, with statements from the president like "I'm not an undertaker, okay?" and "So what? I'm sorry." What to do when asked about the number of deaths in the infection in the country? The figures make it clear how reckless the government has been in treating the pandemic as a cold sore. The Brazil Minister of Health changed it 3 times during the pandemic, fact that adds the national tragic panorama caused by the virus. In August, Brazil enters its 50th month of social distance, with more than 1,000 deaths per day, with virtually no state strategy to control this threat. In addition, we have a high rate of underreported cases of the territory, with the country with the most deaths among the healthcare professionals, and the president was considered the worst world leader in the fight against COVID by the Washington Post. The attitudes are also detrimental to leave the country out of a license with the World Health Organization for future treatments and vaccines. Right now, we face irreplaceable losses for our country history. Indigenous people are the most affected at the moment. There are more than 148 ethnic groups with confirmed cases of coronavirus and more than 23,000 infected and 640 deaths. Most deaths are concentrated in the Amazon region, northern Brazil. So it's a huge problem for us. On the other hand, we have a unified health system, SUS, Sistema Único de Saúde, which provide the Brazilian people with free treatment in the fight against COVID. SUS is the key point to discuss public health from another perspective, bring the light once again the important discussion on universal access to health. Meanwhile, we're still facing the impacts of neoliberal measures aimed to dismantling our health system in favor of opening space for the private health sector. We at the DENEM fight for the right of people to have universal, free, and quality health. Only in this way we can build a more just society for everyone. For us, health is not a commodity. It should not be a source of profit. Health is a universal right guaranteed by the Article 6 of the 1988 Brazilian Federal Constitution. 100,000 deaths in Brazil, more than half of them were preventable. They're not just numbers. They're 100,000 stories, lives, and loved ones. And we're here today in memory of the victims to honor the stories, their families, and their friends. Thank you.
Okay, Iago, thank you very much for your presentation. So I think pretty much that's it. Thank you guys very much who still watching and since the beginning. Thank you very much again to Abdul Majid, to Safa, to Yasmin, to Iago, and that's it, guys. Bye-bye.
Thank you for hosting us.
Bye-bye.
It was our pleasure.
Thank you, guys. It was awesome. See you then.
Awesome, guys. See you later. Bye-bye.
A DENEM é de quê? De luta! E a DENEM é de quê? De luta! A DENEM é de quê? De luta!